form of pink eye is terrorizing Houstonians, and the symptoms are worse than before.
Fox 26's Dinesh Broom is live in Southwest Houston to give us more info about it. Dinesh?
Good morning. I've certainly been getting quite the education this morning on pink eye. So somebody might have bacterial pink eye. That one, they say that one you can still get rid of pretty simply, but it's the viral that has now somehow transformed. It's really making it more resistant to the typical medications that doctors would be prescribing. We actually got to talk to a patient earlier this morning. He got a checkup right before having to head off to work. Take a listen to what he said it's been like dealing with this new viral pink eye.
Well, when I woke up on Saturday 2 weeks ago, it was just, my eyes were really red. Well, one eye was really red. And then I felt like there was some foreign object in my eye.
And so it's taken him about 2 weeks to even try to start getting better, which is really a long period of time, much longer than what Dr. Allen normally tells us it would take. Thank you so much for continuing to join us this morning. So since you said you've been seeing so many more patients with this, it's very contagious and so hard to get rid of. How can people prevent this spread?
Well, generally speaking, hand washing more frequently. Again, I don't mean to be obsessive compulsive about it, but if someone in your family has a cold, or if you have a cold, then washing your hands more frequently would be beneficial, because obviously this is a virus and it's going to spread. Covering your mouth when you sneeze and sneezing into your shirt sleeve of your elbow, those are beneficial things. A sneeze can travel 14 feet, and since this is an upper respiratory tract infection in a sense, then it's going to travel with a sneeze. So if someone sneezes from you 14 feet away, it can get you in the eye. And so again, not to make people overly concerned about it, but if their relatives or what have you are sneezing and coughing, then they need to teach them to sneeze into their elbow, and that way you don't touch it later until the virus dies off. And to wash their hands, and if people in the house are sick, to wash their sheets, pillowcases and blankets and things in hot water. A problem we have, of course, is having gray and colored sheets and things, and so they don't want to wash them in hot water, so they're not killing the virus. But the virus doesn't really live that long on a dry surface. It's mostly in mucous membrane secretions, sneezes and coughs and things of that nature.
So wash those hands. Thank you, Dr. Allen Panzer. We've been with him all morning. He's been giving us some great info, and we'll have another interview with another patient coming up in our next hour. For now, live in Southwest Houston, Dinesh Broom, Fox 26 News.